chairs. Or do you want, well, because people are trickling in still online, Victoria, we'll have you go last.
Perfect.
Okay, all right, far left. You want me to start? Well, all the way down around.
All the way.
Yes, very good.
Good morning and thanks everyone for being here today. My name is Ross Silvers and I'm here obviously on the CoC board and representing the transportation sector, the STA. I'm a current board member going for re-election.
And I'll just go since I
Yeah.
can get coffee. Sorry, I can't resist it. I'm Beth Wetzel. I'm a city commissioner and vice mayor for the city of Treasure Island. And we have an innovative program, a lift program to deal with some of our chronic homelessness. So that's kind of.
Good morning, my name is Jeannie Bowley. I'm the director of the Family Services Initiative at the Juvenile Welfare Board. I'm relatively new to the CoC. I think I've been on for a few months now. I've been working in the community for many years and look forward to continuing to work with the group to assist some of our families and homeless individuals in Pinellas County.
My name is Sam Picard. I'm the pastor of Missio Dei Church in St. Petersburg, which serves mostly homeless and marginally housed folks. I serve in the faith-based seat on the CoC board.
And good morning and happy new year. I'm Trinia Cox. I'm an HLA board and also we are the community advocate for marginalized communities. Thank you so much for joining me.
Hi, I'm Pamela Qualls. I'm the chair of the HLA board and currently serving as the interim CEO of the HLA. I'm also the chief operating officer here at Just Add Power, which is why we have access to this building. And I did want to give you quick instructions that if you go out this door and then to your left, you'll come to restrooms. If we would have to get out of here for any reason quickly, go to the nearest of the 3 double doors here, not that one, but these two are just. Here you go that way, here, just go straight. Thank you. And we appreciate you serving as our interim chair or CEO of the HLA and allowing us to meet here at a nice neutral area. So I'm Kathleen Beckman, chair of the CoC, and I also serve on the Clearwater City Council.
My name is Chuck Lane. I work for the city of Clearwater. I'm the assistant director of the Economic Development and Housing Department. I oversee our housing and community development.
Good morning and happy new year. I'm Deborah Big Sanders. I am the chair of St. Petersburg City Council.
I'm Michael Gelazo. I am the CEO, executive director of People Empowerment and Restoring Communities. I'm here. We have several housing programs, but I'm also here as a representative of the providers.
Good morning, my name is Mariana Forsyth. I'm the CEO of CoC and representing the Providers Council.
Good morning, April Lott. I was gonna say chair of the Providers Council, vice chair of the Providers Council of Directions for Living.
Good morning, I'm Sarah Madden. I'm a homeless resource specialist with the Public Defender's Office, and I'm the designee representing Sarah as a.
Zach H. Pinellas Sheriff's Office, representing Sheriff Terry.
Good morning, everyone. Kevin Moran, I'm the CEO for Polish Centers, and I guess the incoming chair of the Providers Council.
He doesn't guess, he for sure. Chair of the Providers Council.
We'll take a vote of confidence. That's right.
Good morning, everyone. I'm Abby Effingham. I'm the director of social services at the Housing Authority. On behalf of Daniel Thomas, who is the CEO.
Jennifer, want to start?
Good morning. It's good to be here. I am formerly homeless as of 2 months. I'm a member of the CoC and I'm also working towards being on the lived experience advisory.
Good morning, I'm Camille Henry. I am the Chief Financial Officer at HCA Florida Northside Hospital.
Hi, I'm Christine Long with Metropolitan Ministries. I'm the Executive Vice President and Chief Programs Officer.
And Mike Creation, I'm the LEAC committee and
Elise Mencock, Chief Programs Officer for Pinellas County Housing Authority, and hopefully a member of the CoC coming up.
Good morning, I'm Judith Warren, Chief Program Officer for St. Vincent de Paul Care.
Dan McDonald, retired normal salary police officer from Tampa. And I also helped Fred around, a couple years back with the team, that was
Good morning, I'm Blossom Camper, homeless program coordinator at the VA healthcare system and up for election for the seat to represent veteran care.
Good morning, Kaylee Saganowski, here today as a COC member. Hi, I'm Dr. Monica Discolo. I joined as a concerned citizen. I belong to a few different organizations, but I'm going to select one to represent.
Morning, Paul Murray, Brandon Powell, here over to build the forum for the vote.
We appreciate everybody who does that. Good morning, I'm Helen Rack, I'm the Social Services Planning Manager for the City of St. Petersburg.
Good morning, I'm Teresa Jones, former manager for homeless social service city of St. Pete, retired and now a concerned citizen.
Hi, everybody. I'm Anne Marie Winter with the Area Agency on Aging of Pasco Pinellas. I serve as the executive director, and I'm hoping to be an at-large member of the CoC board.
Hi, everybody. Victoria Kelly. I am the Senior Manager of Organizational Advancement and Strategy with the HLA. And thank you all for being here early in the morning and for bearing with our setup, my craziness. And then online, we have 13 folks or 12 folks who have joined us. Our esteemed attorney, Charlie Curtis, is online. We have Commissioner Renee Flowers, Daisy Correa, Felicia Patterson. Oh, Commissioner Flowers is saying hey to everybody. There we go. We have Jason M. I apologize, Jason M. I'm not sure what your last name is. We have Karen Yatchum. We have Michael Raposa. We have Sean King, our immediate past chair. We have Suzanne Boylan from the HLA, and then a couple of folks whose names I can't quite tell. You could just make sure you put those in the chat for me so that I make sure I count for your attendance.
Thank you very, very much. Well, it is absolutely heartwarming to know that we have regular citizens who just care here. That's one of my goals, is to have more people like that, especially and more faith-based organizations to just show up and become part of our work. So I appreciate you all being here. And thank you. All right, so we have a membership meeting that we are starting right now. So I'm going to go through an election review. And so we have policies and procedures. We need a quorum of 35 members to continue on with the official. How many do we have right now? 30.
7, 8, 11, 12, 13, 14, 15. Not quite there yet. 16.
Well, right, well, yeah, and so what we'll do is we will go through the process and make a recommendation to the executive board that they can then accept the recommendation, but it's not a binding vote, correct?
Yes, yes. So that'll be what we do. We will continue on with the election as we would normally, and this will just be, if we don't have quorum, a vote to recommend the nominees. So we will proceed as normal. It just won't be a binding vote until the board votes to approve or reject that at the meeting that will immediately follow this one.
And I know Charlie's online. Can we ask Charlie, I mean, is there any procedure that would allow us to suspend the rule that we can't count online? Because with online, we're at 35, correct? Or no?
No.
Could we ask Charlie if there's any procedure that would allow us to do that?
I think that's.
Yeah, so unfortunately,
If Charlie wants to weigh in, I'm assuming he's listening.
Let me see if that would get us there.
We asked Charlie about different ways around because we've struggled with quorum, and it's one of the things that we're gonna be looking at, amending the charter first thing at the beginning of this year. Change that quorum requirement, because with such a large board, it's hard. We've consistently struggled. And I'm just gonna tell you, you know, this is my 4th year. We've consistently struggled with a number of things. We've had, 3 different leaders of the HLA. We've gone through COVID, virtual meetings, all that stuff. So it's, other organizations are experiencing this too,
Which should be a problem.
getting people
They're
back.
here.
Yeah.
They're watching me.
Unfortunately, it still would not be enough.
Okay, still not enough. All right, we'll cross that bridge with charter revisions in,
But if we can go ahead with the election, do it on
absolutely,
the vote.
Absolutely.
Committee, then it'd be ratified.
that's right.
My suggestion is not only to do that, but those who are gonna join the board, then join us, let's get forward.
Mhm, absolutely. Teresa?
Is it appropriate for me to ask a question?
Sure.
So the 35 members, that's of the general membership.
Yes, ma'am.
And,
So-
you know, starting, we've gone above and beyond with letting people know about the meeting, please RSVP, all that stuff, you know, nudges. And so it's just, it's a hurdle that we've continued to have to get over, and we're gonna change it, you know, this year so that we don't have it as intensely as we have. But the interesting thing about, you know, the election is, I think except for one seat, there's not a lot of discussion. I mean, we have phenomenal candidates. We don't have more candidates for a seat except for one, I believe. And so it should be smooth sailing that way. All good? Okay,
May I ask a quick question?
sure.
So I'm gonna say Vincent de Paul Cares, are we able to vote as an agency, or do you have to have a designated person? In other words, I'm new, so am I able to come here and vote today, or does it have to be a specific designate?
It's my understanding, it's supposed to be a specific.
That's what I meant. I just want
Yeah,
to.
I mean, I've got the charter here, you've got to have it designated.
And since you were last on the board, none of that changed.
Okay.
It's, it has to be someone who can actually make decisions for the agency or their designee. Right?
And a name,
That's
like
what's in the charter.
Lieutenant Patience.
Thank you. I appreciate it.
Okay.
And Judith Warren is
So
fully
our election
authorized.
policies and procedures, will, you know, set aside the form for right now. This will be a, recommendation to the board. So eligible voters are people who have joined or renewed their membership by, December 29th last year. They're attending in person. Our eligible candidates had to have submitted a board nomination form by December 22nd of last year. Joined or renewed their membership by December 29th. They have to live in, work in, or serve Pinellas, and we will not have floor nominations. So you've all received a packet of applicants, and their, applications. So our election policies and procedures are, our candidates will be presented in groups according to the seat applied for. Each individual candidate, if you're here, hopefully you're here. I think most of you are here, so you went through your names. If you'd just like to say a few things, you know, have a minute or two, to talk about what you're hoping to work on and contribute to as a member of the CoC, that would be phenomenal. And then we'll do a vote, a roll call vote here that really is for that recommendation. Any questions on that? Okay. All right. So we're going to start with the veteran or veteran organization. That's you. So this is a Pinellas veteran or representative of an organization serving Pinellas veterans, and our candidate is Blossom Capper. Did I pronounce your last name?
Yes.
Okay. So
We also had an addition. Anne Marie Winter is also a candidate for that.
Andrea?
Anne Marie Winter with the area agent.
Oh,
Credit.
that's right. And that was a little, okay. And Andrea Winter. Okay. Anne Marie?
For the veteran position. This is what I reached out to you about yesterday.
Yes, Anne Marie is nominated for the veteran and at-large seat.
And she'd applied much earlier. We just it kind of slipped through. Okay.
Yes, that was HLA's error, not Anne Marie's.
Okay.
Hold that against me, not her.
All right. So, Blossom, do you want to take a minute? You have up to 3 minutes if you'd like to say anything about your candidacy.
Yes. Hi, I'm Blossom Capper. I'm currently in the homeless program coordinator at the VA healthcare system. What that means, I have my hands in a lot of different pieces of veteran homeless care at VA. I work very closely with several community agencies. We have contract shelters in the community. We also have grant and Continuum programs in the community where persons are awarded grant money agencies, such as Homeless Empowerment Project, Bully, St. Vincent de Paul. So we oversee those contracts and we oversee those grants. And I also supervise the persons that are working closely with the veterans at those contracted programs. I also lead a lot of the large outreach events. We have a large homeless outreach event in April every year at Bay Pines VA, where we invite veterans to come. We invite several community agencies to come. So we do, and particularly in my role, a lot of strong community collaboration. I always say, and I'll say it here again, we could not solve veteran homelessness without the help of the community. So it's really my role to be that linkage, the face of VA, and help link with the community. So I thought it would be a good opportunity to be on this board to just expand that linkage and expand that collaboration with the community. Take back ideas that the community has to VA and vice versa, whatever our needs and gaps are, hopefully I can get that word out through this forum. So I appreciate your consideration. Thank you.
Thank you.
Are we allowed to say anything on people's behalf?
You have up to 1 minute and 15 seconds.
If any of us work with Blossom, she is as talented and knowledgeable of the entire VA system as it relates to homelessness than anyone I've worked with, and she would be a great addition. So we look forward to that representation, because listen, I don't, and anytime I have an issue, we can't figure it out through liaisons and so forth, we go to Blossom. Your work speaks for itself. Thank you for what you've always done for you.
Thank you.
Since we have any questions? Go ahead.
Blossom, thank you. I have 2 questions for you. One, typically the representation on the board is people with final decision-making authority for their organization because of the decisions and the pace in which we work. So would you have any challenge with getting some kind of documentation from the VA that says that you can make full and final decisions on behalf of the VA relative to homeless veteran services?
Relative to homeless services?
Yeah.
I don't want to say for certain, but I feel pretty confident that I could get some type of documentation if it's relevant to homeless services, yes.
That you would have full and final decision-making authority? Okay. And the second thing I'd like to say is that if for any reason you don't make it here, I want to strongly encourage you to join the Providers Council. We would love to have you there. The process for joining the Providers Council is far less formal. And although there's an application for it, but I really want to strongly encourage you to get involved in the Providers Council because that we can use you there for sure.
Okay, thank you.
Thank you. And I think your point about people having full and final decision-making is interesting. We're past the 3 minutes, okay. All right.
All right.
Okay, Anne Marie.
Yes, good morning. I'm Anne Marie Winter. I'm the executive director with the Area Agency on Aging of Pasco Pinellas. If there's only one VA seat, I am going to withdraw my nomination for that. But I do want to say that there's no seat for seniors. And HUD has determined that the largest population in the United States currently experiencing homelessness are seniors 60 plus. We do serve veterans. We have a contract with the Federal Veterans Administration and serve several hundred senior veterans per year, also disabled veterans over the age of 18. If there is only one seat, however, I will withdraw, understanding that the VA administration is here and if they do have the authority to make decisions. As the executive director, the Board of Trustees of the Area Agency on Aging, of course, has entrusted in me decision-making authority. But if there's only one seat, I support Blossom and will stand as an at-large member. Thank you very much.
Thank you.
So I think hurting my knee has made me real randy. I've been giving Anne Marie this representation needs to be on this board, and it's needed to be on this board for a long time. She's heard it from me, but everyone here's heard it from me, is when we have to prioritize populations, this is the voice that has never really been at this table. So we're glad that you are choosing to submit yourself to this great work. That's how I'm gonna say it.
And of course, I want to say, right, to Anne Marie, before I worked with Anne Marie for many, many years, I know her well. She's a beautiful human being and very committed to a lot of the priority populations that we are about. I feel like I've been the voice of seniors for the last several years. I will say again to Anne Marie that regardless of what happens here today, we would desperately want you at the Providers Council. A member of your staff, somebody who has full final decision-making authority to attend the Providers Council. A lot of the work gets done in the Providers Council. For those people who have not read the charter, the Providers Council makes almost every decision there is related to services. And then those decisions are brought to the full board for discussion and vote, and oftentimes simply ratification. So a lot of the work is done at Providers Council. So for those of you who are not members of the Providers Council, I have to, right, everybody wants to be somehow on a board of directors, but the work is done in Providers Council. So if you aren't here, I desperately want to make the plea to join the Providers Council, which is where, hours of discussion take place and ultimately decisions are made. And if you read the charter, we bring those decisions to the board of directors for ratification, discussion, those kinds of things, and then implementation. So if that work is not happening here at this table, just to be clear.
If I could add to that too, is this did come up in December. November, last time we met, is that we've had multiple meetings now, and we are scheduled to have multiple joint meetings of the Providers Council and Funders Council. And again, I could agree or emphasize more what April said in terms of the actual sheer work getting done is
If there's not enough at large seats, obviously this is a seat that we build and represent the elderly population. We need to prioritize a seat on this board for the elderly population if there's not enough at large seats.
I would push this conversation outside of the veteran nomination.
We'll keep focused, that's right. We'll keep focused, we'll get through this, and then we can talk about adding them, as well as amending the charter to have a seat for the elderly population. But really, our statistics show that we're first in the nation for our size CoC for homeless veterans, and that we are exponentially increasing our homeless elderly. Those are the two most important, aside from families with children as well. I think everybody's important, but you absolutely, we need to have your voice, so I appreciate that. Do we need to have a motion or a second to remove Anne Marie's name, or do we just vote? Okay,
We can just.
all right, so we have Blossom Capper as our applicant representative for the veteran or veteran organization. I'm just gonna do a voice because we only have one. All those in favor? Any opposed?
Aye.
Okay, fantastic.
So for the minutes, do we have the motion to approve her or just a general vote?
Do you want a motion for approval or just a motion?
No. Good?
I think since this is a vote to recommend, we
No.
probably should just go ahead and make the motion to recommend Blossom for the seat, and then all in favor, aye.
Okay,
then
for a recommendation.
Point of clarification.
Yes.
Point of clarification. When y'all voted, the only voices I heard were the ones at the table. Are the members
Members
supposed
should
to be
go,
voting
yes.
too?
Yes.
Yes.
So
Now, I'm gonna suggest, because we're not all members out here, I don't believe. Are we?
there
For
are a
those
couple that
dates,
are not.
Victoria.
So we
the
probably
dates.
should be doing a hand vote. That would be my
Okay.
suggestion.
So can we go ahead? Can we restart the vote? Can we call for a motion, a second, and then a vote?
Okay.
Thank you.
I would
Make a
maybe
motion to have Blossom as.
I'll second that. Okay, so a motion in a second. So all those in favor who are members in good standing with our dates that we went through, by a show of hands, vote in favor of Blossom Capper to serve that position. Okay. Do you want to come?
Good, unanimous. Is anybody,
Is it the recommendation?
will you, yep. Will you raise your hand if you are abstaining or voting no? No abstentions or no's? Okay, then let's move forward.
Thank you very much. Our second one, transportation or workforce development, we have one open seat and we have a renewing applicant of Ross Silvers. Okay, we have a motion in a second. Any discussion? All right, all those in favor, again, voting members, to appoint, Ross Silvers as our transportation workforce development, show of hands. Thank you. Any of those voting no or abstaining? Our healthcare EMS fire, we have one open seat and we have, what about the I don't have.
I apologize, y'all. I think that I might have accidentally missed Danielle in my slideshow.
That's okay.
That's my apologies, Danielle. She's not even here and I have to apologize to her. She's not even here.
Okay.
Apologies. Okay, Danielle Thomas is the nominee, the renewing nominee for the Housing Authority seat. We have another Housing Authority seat that is currently held by Neil Brickfield from the Pinellas County Housing Authority as well.
Danielle.
Second.
We have a motion in a second. All right, we'll call for a vote of recommendation. All those in favor? Any opposed or abstained? Okay, great job. I have healthcare on my next one.
Yes.
Just want to make sure. All right, healthcare, EMS and fire. So our representative, our new applicant is Camille Henry. Camille, any?
Hi, again. So I'm Camille Henry, and I'm the Chief Financial Officer at HCU Florida Northside Hospital. So thank you for this opportunity. One of the main reasons that I want to be on this board is that a large part of my job is care coordination for patients after they leave the hospital. And at Northside, if you're familiar with our facility, we do serve a significant population of individuals that are experiencing homelessness. And so things that are important when you discharge from a hospital is having running water, a clean environment, electricity, in case you go home with medical equipment or you have a wound that needs to remain clean. Also follow-up care so that you don't, end up back in the hospital, which involves physician appointments, medications, things like that. So a big part of our job is working with our community resources to ensure that they have a place to go and can seek out those services. So I'm hoping by joining this board that I'll be able, like Blossom, to be able to expand on those relationships that I've already built and be able to provide even more services for the patients that I have the privilege of serving every day. This is also very personal to me. My sister suffered from homelessness for many years. It was by choice. She did not appreciate the rules and restrictions of shelters. I've seen firsthand, how it impacts individuals, not only physically and not having a shelter, but also mentally and emotionally, and the struggles that they have with maybe giving up their freedom or their independence in order to get those resources that they need. So I'm just hoping that, with the work that we do here, I can help others, and hopefully together we'll just prevent homelessness for the community here in Pinellas. Any questions for me?
My recommendation is Camille Henry for the healthcare EMS and fire.
I do.
Okay.
Again, my questions are the same to me, for you, Camille. I loved your application, by the way, and the fact that you were willing to share your personal story about your sister. I'm assuming in your role as the CFO that you would have full and final decision-making authority on behalf of the of your, of the HCA related to?
Not
this issue?
HCA, but of North Side
Of
of
North
Florida,
Side, okay.
yeah, because there is a lot,
A lot.
169. HCA hospitals. So
I just want you to make decisions for all of them.
I don't know why I didn't know about that,
Okay.
but I can handle for North Side.
Okay, yes, and again, I'm gonna sound like a broken record, but I do just wanna say, regardless of what happens here today, that you get involved with the Providers Council. Work is done at the Providers Council, so
Yes,
where we
and-
need you and where we need your voice and your action and your commitment to solving and preventing homelessness is at the Providers Council.
And thank you for letting me be observer on the last virtual meeting that you had. That was very informative and I appreciated that opportunity. So thank you.
Fantastic. So we do have a we have a motion and a second.
Do the vote?
Yes. All right. So all those in favor of that recommendation of Camille? And any opposed or abstaining? Fantastic. Thank you. Well, I'm glad we're ratified the board meeting, but I too was impressed and glad to have you here. Faith-based. So we have, our candidate is Sam, he's a renewing applicant, Sam Picard, who's served us faithfully and really been a big asset.
Second.
Sam, did you want to speak at all?
No, it's fine.
Okay.
I don't do much anyway.
There you go. All right, so we have a motion in a second. All those in favor of that recommendation of Sam Picard for saying. And any opposed or abstaining? Fantastic. Currently or formerly homeless, so we have Mr. Michael Crichton. Michael, am I pronouncing your last name correctly? Right. Okay. Would you like to speak?
Really, just. I'm able to be of some help. My skills range from studying project management, going to SBC, currently trying to get the AA degree. I was formerly homeless, so I knew. I don't think so, I don't say harbor, I know the beginnings, Claremont, so I've been around. And so I certainly know some of the issues people are facing, only in subsidized housing disorder, needing foundation services. And it's been a tremendous help. It's one of those places that it reduced income and the rent is so unbelievably affordable. Without it, I would probably still be homeless because the rents are incredible high, and that's something that I think should be addressed somehow in some form or fashion. Other than that, I'm glad to let my skills in technology, marketing or sales, whatever is needed to help.
Well, thank you. Yeah, your application was incredibly impressive, but I'm really glad you're here. Thank you very much.
If you don't mind, I was gonna, Jennifer, do you wanna?
I really didn't have, the mental capacity to fill out, especially with everything that was going on. I was married into a new apartment. And then, just the complex PTSD that I suffer from. But I come to every meeting. I have mental health. I'm aware of the treatment that unhoused citizens receive. I watch it. I've seen it just recently in the last couple of weeks, and I bring compassion, understanding, and love to the league committee. And I'm honored to be in a room full of so many people that I'm just a country little girl that, you know what I'm saying? I don't have a college education. I just know what I've been through, and I know what I've seen, and I know what I've seen wrong.
Do you mind if I ask, if you could speak to what the lived experience committee talked about Michael's nomination? Do you mind if you could speak about that?
He was unanimous. He's very intelligent. He definitely knows how to speak, because I have, ADHD, so I can be all over the place, but I couldn't think of a better nomination than him.
Thank you for that recommendation, Jennifer. And just to say, Jennifer is an incredibly active member. She's lives by the border of Clearwater and Largo. And she speaks before our council meetings. She distributes the CoC flyers, is working continuously to engage people with lived experience in work. And I applaud her efforts, and you continue to be, you know,
I
a voice at the table.
like, I have these.
Yeah.
These are new flyers. These are 6 people of who the Pinellas County Continuum Care Help. Like I literally do have like 6 months.
Yeah. So she's a great partner, and we'll go forward into
To the members, and I also explained to them. And I did have a question about that. I remember at the meeting that we had in September, we were talking about the membership fees and how, like, you know, there would be like a tier for like the for-profit partners, the faith-based organizations, and also the nonprofit government partners and stuff, you know. Because some people are for-profit, but they only make, you know, half a million a year or whatever. So, that's
fantastic.
Yeah, are we making a motion for both at the same time since we have 2 seats?
No, Jennifer is not up for it. Oh,
I'm saying it's just open seats.
right. It's just to make the recommendation for Michael. Jennifer did not want to take an official seat.
Oh, okay.
She's just speaking on behalf of Michael.
yeah, I definitely,
I make a motion to accept Michael, as the
Right.
former homes.
Second.
Okay, we have a motion in a second. So, those in favor of Michael, right, as our designee, right? Any, voting no or abstaining? Okay, fantastic. Thank you. We'll make that recommendation to the executive board, Michael. Thank you very, very much. Business, we have 1 open seat and we have 2 candidates.
I must say, unfortunately, Lottie Cuthbertson, who has served on this board for many years, emailed me today. She had to withdraw her application or her nomination. So Esther Matthews is our nominee.
Okay, fantastic. And she has a phenomenal resume. But Esther's not here, correct?
No, nor is Esther online.
Okay. All right. Do I have a motion?
Move approval, move recommendation of estimate. Second.
So we have a motion and a second. Those in favor of Esther Matthews to serve for our business office?
Thank you.
Any voting no or abstaining? Fantastic. Should be a great asset. All right, so I'm going to take Esther off of the at-large, correct? And then we're going to take Camille Henry off of the at-large. And now we have 2 open positions. We have for the at-large members, and we have Teresa Jones, Emily Lloyd, and Christine Long.
Anne Marie.
And Anne Marie.
It's not on the.
Oh, that's right. And Anne Marie for the open? Okay. 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 So now all right.
So before we go into the discussion, we only have 2 seats, right? So I'm trying to figure out, yes, mathematically, how we can make this work. Right, with the list that we have. So one of my, can I ask a question? I want to remember. Okay, so you in your role, correct me if I'm wrong. You in your role, you are also, in addition to being a provider, you are also a funder. Is that correct?
Correct. We are the federally and state designated organization to fund services to seniors in the community to help them age in place.
So one of the things I would like to suggest is to you, to somebody, is to all of us, is that right now we have a designated seat for the Funders Council chair. We are absent a Funders Council chair.
Yes, we are.
Could Anne Marie say yes to and be willing to serve on Funders Council, move into the Funders Council chair position? We would all support you and rally around you and promise your success. And then she would, by that role, would then have a seat In other words, trying to get all of our seats filled and all of the people who, right, this is a good problem to have, that we have more people who want to serve than we have seats for.
Yeah.
So, right, that's a good problem to have. So would you be willing to do that?
I was able to attend the Funders Council meeting, that you recently held. I am not able to stand as the chair, and I appreciate if that, reflects on the decision that you're going to make. I'm happy to serve on the Funders Council. But at this time, not knowing enough about the work that you do, and really being in a position to learn, I am not willing to serve as chair. But very happy to participate and engage in a meaningful way on that council, as well as on the board, should you choose to, elect me.
I respect that.
Thank you.
I would give approval
Sorry.
Anne Marie enter as one of the at-large board members. We've already heard her reason for wanting to serve, and I think I would like to move her forward without an additional discussion. I would make a motion to that effect.
I second that motion.
Okay.
We do, I think, need to go through and give everybody the opportunity to speak before we do that.
Okay.
I'm going to withdraw my application.
That motion to approve right now, we'll table that till right now.
I think I'm next up.
Oh, you're withdrawing, Teresa, you're withdrawing your application to serve as that,
Teresa, there are two, Teresa, there are two seats, by the way. There are two
I
seats.
recognize that. My interest in serving on the board is because I've served for 5 years as the city's manager. I'm very knowledgeable about the need for services for our unhoused population. I've been a strong advocate for years for increasing the diversity on this board. That was one of the reasons that I put in my application. I'm pleased to see that Esther has been appointed to the board, so I feel that she will be a good addition to the board. The other reason that I stepped up to apply was because I think we need a strong voice on this board for the highest percentage of unhoused in our community, and as far as the demographics go. Certainly it's seniors, and I'm certainly concerned as a 70-year-old woman about housing for our seniors. I'm a tenant as well, and I think about the fact my landlord currently has cancer. He dies and something happens, will I be unhoused? So that's a concern. But I'm also concerned about African Americans, and they are the highest percentage in our homeless population. So that was the reasons that I was interested in serving. I feel somewhat comfortable that Esther will feel some of that I've just said, that she will bring some diversity to the board. She is also the president of the NAACP, so I know she will certainly have the interests of African Americans in her forefront, and she's a strong voice. So to some extent, I think what I was interested in doing, that you will get some of that without me being on the board. So that's why I feel somewhat comfortable that if I'm not selected to serve on the board, that the things that concern me will still be addressed.
I'm gonna throw my 2 cents in with that one. I don't know all the candidates, so I'm not gonna, I guess it's hard for me to not be biased on this one because I do know your efforts in regards to your advocacy for the homeless. And I totally agree with you in the respect of the African American community and those numbers in regards to homelessness and some of the disparities that we actually have. I want you to also reconsider, because now with me being chair, we may lose some of that representation. And you might want to let the process kind of follow through before you resign or withdraw your application, because I would strongly love to continue to hear your strong voice. And that is something that you've always brought. So I'm not discounting any other applicants at all, but I know what you bring. And I know where we are in a need of making sure that we have that representation that truly does matter. So I think if we could just go ahead, Madam Chair, with the process, if you will, Ms. Jones, Not the application as of yet. And let's go ahead and go through the process, because I do have another meeting, but I would love to continue to hear your voice. But things are gonna change for the city of St. Petersburg a little bit, so I'm hoping that you would, thank you.
Go ahead. Quickly, I support that reconsideration. Okay, we're going to recess, you're gonna withdraw that, removal right now?
Yeah, I'll just.
Okay.
Withdrawal.
So, but just to confirm, so that we can give people a moment to speak. So Camille Henry will not be an applicant to consider, correct? Because we've already appointed or made a recommendation. So we do have Teresa Jones who's spoken. We do have Emily Lloyd, who is a new applicant. And we have Christine Long. Esther Matthews, we're not going to consider here because we've already made a recommendation for her at the board. And then Anne Marie, we've heard your wonderful statement. So Emily Lloyd and Christine Long. So it's Emily Lloyd.
Emily Lloyd is not here in person, and I am looking online just to see if Emily is here. Emily is not here online either.
Okay, Christine Long.
Hi, everybody. Hi, I am Christine Long, and I'm the Executive Vice President, Chief Programs Officer at Metropolitan Ministries. And I have just had my 30th anniversary working at Metropolitan Ministries last week. So I have had the privilege of serving in the homeless capacity for 30 years, of caring for this community. And over my 30 years, I've had lots of opportunities to participate on boards similar as this. I've done a lot of work in Hillsborough County and Pasco County, and Metropolitan Ministries has started providing some services in Pinellas County. I would love to offer my expertise and experience to this board. I've not only have served on continuum care boards, these coalition boards at the local levels, but also at the state level, serving in the Florida Housing Coalition and Florida Homeless Coalition boards. So I have a deep understanding of all the impacts of the COCs, the work of the coalition, the work of the community. But most importantly for me, I care about our homeless neighbors. I work on something that makes a difference for them, changes and impacts people's lives. And at this point in my career, with my expertise, really serving on boards, I feel this is the best way that I can serve. So if you would like my help, I'd be happy to join the team. Thank you.
There is no doubt that we want your help.
Absolutely. Absolutely be on the team. I mean, members of our, it's, open members are. So, all right, so we have Teresa Jones, Christine Long, and Anne Marie.
Madam Chair. I would move recommending Teresa Jones and Anne Marie Winters for the 2 at-large seats. I'd speak to that briefly. Christine, you bring a ton of experience, which is really valuable. I think there's a process piece that we need to attend to as a board when we think about charter review, because the key component of the different seats is having strong provider voice, but through a defined role. So that if the board were all providers, we wouldn't get the same diversity of opinion representing the whole community. So the role of the Providers Council, as April said so eloquently, is to both organize and support and make policy for providers. And then the Providers Council determines which providers sit on the board of directors. And I think that that's the most appropriate way to hear. So and we've seen throughout this process today that there are folks who could be on the providers board potentially because they provide services. Metropolitan Ministries is a homeless services provider. And I feel like that would be the most appropriate venue for that. So that would be my recommendation.
Second.
So we're gonna make we have a motion and a second for 2 at once. I thought we were gonna call these individuals.
Told you not to come in. Before we move on,
Yes.
We need this board, this committee, whatever you want to call it, to find a way to get Metropolitan Ministries involved. The work that they're doing in South Side, keeping people housed and getting them housed. The work that they're starting to do in Clearwater with HEB.
Yeah.
Excuse me, I'm losing my voice. The workforce development and the work that they've done with Safe Harbor for the last 11 years, serving every meal that we have over there. it's important to have them be a voice and be involved in this committee because they really want to make a bigger impact in Pinellas County.
You know, again, as we do that charter review early this year, we could maybe have two appointments from the religious community. I mean, it'd be an easy change, I think, at least. So we need to make recommendations. We need to have motion for our recommendations for two candidates for these at-large seats.
Do you vote separately or?
Separately, yeah. So does somebody want to make a motion?
I'll make a motion for Anne Marie Winter to.
We already have.
We have a motion in a second.
That was a couple. It was couple.
He still needs to withdraw.
Oh, I'm sorry.
Okay, my fault.
Okay. So you moved to withdraw it?
Yeah.
Okay.
Okay, let me make a current.
I'll make a motion to add Anne Marie Winter to this board and at-large.
So we have a motion and a second. All those in favor of approving Anne Marie Winter for the. Any abstaining or voting no? There's none.
Oh, who was it?
Daniel.
Thank you.
I don't understand that she didn't have that.
All right. We need to fill the second position. I move for the second position that is Teresa Jones to serve as a position. I think her expertise, her compassion, experience speaks to her vitality, and she'll bring to this community. Her strong voice cannot be ignored, and persistence will not allow that to occur. I think it's always a win-win with her when she serves, and I think it's really for her value to include her and just have one other thing that I say. We have a motion in a second. All those in favor of Teresa Jones. Any abstainers? One abstain. Well, thank you. I'm happy to have Teresa and Anne Marie as these two at-large seats. Christine, your application was phenomenal, and I look forward to working with you. Continuing on, we'll find a place for you at the table. Your voice is incredibly important. So thank you for applause. All right.
Can I kind of make a quick comment?
Sure.
Christine, I hope you'll join the Providers Council. As you know, we all sort of joke with each other because we've done this together for a long time, but that is really where your work is, and we absolutely need you at that table. And whether that, you know, we go through charter review and it goes to the big board, we'll deal with that later, but we need you in the, you're in the battle, you're in the, so please, you know, join us.
I'm looking forward to deeper engagement and all the levels, and honored to help them get it.
There's so much potential in the faith-based community throughout the county. I feel positive momentum. We're doing good things in Pinellas. So thank you. All right, so we're good with our recommendations. Any final comments? Yes.
I just wanted to make a brief comment. I didn't necessarily get to explain, be careful. I unfortunately got my application a little bit late from out of target for Pinellas Park position. I apologize for that. I have some issues. But I just wanted to make a recommendation that when we read through the charter, potentially look at a substance abuse chair position. I work in the substance abuse field. So I just feel if I'm not going to have a place on the board, that's something that should be considered in the future. I work for New Season. I'm the director of a clinic in Tarpon Springs, and I'm also on the board of directors for the Southern Pipeline. And that serves women with their healthcare financial barriers that they're experiencing for bills or upcoming co-pays. I'm also a local artist in the community, so I feel like I have a good amount of perspective. So I just wanted to introduce myself a little bit better and then just recommend the substance abuse.
Excellent recommendation. Very much. Yeah.
I think it's gonna sound a little bit like a broken record. It's the purpose of the providers.
Yes.
The Providers Council is full of mental health providers, substance abuse providers, and other housing providers. So, you know, we need voice the need, the perspective there, and then that becomes the vehicle for representation on the board. For these seats, because a lot of times, to be honest with you, it's it's the same people and providers council that are representing this board, because we're constantly trying to encourage and get other people to join the providers council and help our. Absolutely.
Yeah, I'll definitely look into it. I
We
would,
don't have a specific mental health seat on the
Right,
board, or,
right.
we providers council represents all of those.
okay,
things.
yeah, I'll definitely look into it. I was, active in the Hillsborough COC very frequently, and I just took on a bigger clinic in Tarpon Springs, so I was trying to get back involved with you guys.
Thank you.
Over here.
But I
Please consider joining.
think it goes without saying that.
Is it
When
trust?
you do
Yes.
charter review,
Yes.
that there are some things like that are specific seats that. Because I know we sort of fit it in and, like Mariana's here as part of the Providers Council. I serve on the Public Safety Coordinating Council and I'm represent reentry. Looking at returning citizens work, Zach does it, a lot of us do. I mean, I think we could look at those seats maybe in a different lens. I think that's a great point that you got.
Thank you. Yeah,
But
maybe like
I will emphasize what Kevin and April and everyone else said, please.
The work
is
is being
being
done and you're welcome. Absolutely.
Yeah, thank you. I also have a lot of expertise in the LGBTQ community. so
Phenomenal.
I'd love to
That's just phenomenal. That's what we need. Nobody's ever gonna shut the door and say you can't come into a meeting and lend your voice. I mean, really. Can you, you have her name? What's your name?
Monica DiScolo.
Okay.
I submitted my application,
Okay.
it was past the 29th.
Stuff happens. It was busy. Yeah.
Can I just say, again, I love this conversation, it sounds like perhaps I've got a little bit of frustration because because where the working places in the Providers Council, this conversation about charter review, I've been a part of this organization, I've done 7 charter reviews. Charlie is on, right, he's our attorney, he's amazing, but we don't have quorum today, just to be clear. This board cannot be a 78-member board because we're trying to represent every little nuance there is. Guess where we can do that? We can do that at Providers Council. There is not a cap. You do have quorum needs at Providers Council. We have not failed to achieve quorum in Providers Council. Just to be clear, we get quorum because we have providers who are doing this work day in and day out. So again, I understand that everybody wants to be on a board of directors, but we are never going to, I will never support that we have a 78-member CoC board. We aren't ever going to achieve quorum. It'll be difficult to get the work done that way.
Yeah.
Where we need all of these nuances and dividing and separating the type of provider that is at the table is at Providers Council. And I just can't emphasize that enough. There's a lot of new faces here today who have not been to Providers Council. I would recommend everybody who is a member of the CoC that you are reading the Hearth Act and that you understand the Hearth Act. I would recommend that you read the charter for the CoC and that you read the charter for the Funders Council and for Providers Council. There are charters that govern every one of these things that all come from the Hearth Act. And I would, if you're not familiar with everything that is contained, first in the Hearth Act and second in these charters, some of this discussion it starts to take on a life that is already outlined in charter.
Okay. Fantastic. And I would, yeah, go ahead, Victoria.
I was just gonna say, the HLA, as a follow-up to this meeting, can and will send out applications for these groups, the schedule for these groups, and the descriptors for these groups, so that everybody knows what the opportunities are and how to join. So we can definitely follow up with that. You might not get it from me this week, I apologize, but I will get it to you soon, I promise.
There isn't an application fee, there's no cost to join the Providers Council or the Funders Council for that matter, right? There is an application and you do have to be able to attest to a variety of things. But other than that, it is a very seamless, pretty quick process, and we would love to have you.
It's the boots on the ground, that Providers Council is, you need to, those are the people that are right on the ground every day. And that's where I think
super meaningful, the most meaningful conversations happen. And then when we have our joint providers funders council meetings, which I think are incredibly impactful as well. A lot of work gets done.
And then we elect officers there for the Providers Council, and it is there that we elect the four, actually it's 3 plus the chair, but the 3 members of the Providers Council who then sit and represent the provider's voice on this board of directors. So we are never going to have a 78-member board of providers for the CoC, but we will always have, right, absent a charter change, we will always have at least 3-4 voices of providers at this table via our charter arrangement and charter agreement with the CoC. So just know, right, that you can get involved through the Provider Council and ultimately be here, and that really is the way that it works beautifully.
Thank you. Yes.
I'm sorry, I have a question. Is it possible that if it's, for example, if I'm not able to participate on the Providers Council, I could have my chief operating officer who, would that be possible for her to be the Providers Council member from our organization, understanding that she is a signatory of the organization and has decision-making authority?
Yes, with that caveat, the answer is yes.
Right, okay, because I think that will help, right? So that it's not another meeting, that we actually have another individual who can participate. Thank you.
And if I could serve as an example, when I was the manager for homeless and social services for the city of St. Petersburg, our board member from the city of St. Petersburg is an elected official, Councilmember Sanders. The participant on the Providers Council, and I applied to participate, was myself in my role as the manager of homeless services.
Great.
Also, I served on the Funders Council as well, because the city of St. Petersburg was a funder for services. So that was how the folks that are most, in my opinion, the most closely related to the matter are serving in these roles that
Right.
April mentioned. Is that, because we at one point were a provider, and that's why we were on the Providers Council. More now, more recently are funding more so than providing. So I would, if I was, I'm not telling to it, we got the Funders Council, both. So, but the point is that our elected officials, those that are from, like Council Member Beckman from the city of Clearwater, she's on the board here because the charter actually requires that the representatives from the city governments be an elected official who can make decisions.
Recommend, and be nice if I could make decisions.
Well, you're in a position to impact decisions.
Yes, hopefully.
And then the folks from the city of Clearwater staff were Chuck.
Number
He was
one,
on the
yeah.
board too, but he was also on the Providers Council or
Funders Council. We don't provide.
I don't know if that helped.
The only caveat is the one that you put at the end, Anne Marie, which is that with the application for both the Funders Council and the Providers Council has an attestation that that whoever the person is, there's 2 caveats. One is that whoever the person is, that we want at these councils, we want full and final decision-making authority because of the process that I've just described, which is that a recommendation and or a decision is going to come out of Providers Council that then's going to come here for vote and or ratification that can and absolutely will change processes at a provider's agency. Right. So we're going to vote on things. So then if the CEO, let's just say, is like, I didn't agree to this, why, right? Then we get into a challenge. The second one is, the second caveat is that there is no rotating back and forth. So if you were to designate your COO, for example, then that designee would be the one who's attending always.
Right.
And the reason for that is because these discussions and dialogues, right, are layered and they go on for months, right? And so if people are rotating in and out, we can't ever keep people up to speed on everything. And so then we start revisiting things that were discussed at the last meeting because this person wasn't there. And so that becomes a challenge. For you though, I would encourage you strongly that if you identify your COO to be a member of the Providers Council, that would be wonderful. but that you would get involved in funders council. that
For
you-
sure,
That
yeah.
you personally would be there.
Yes.
Because I think that your personality would be helpful to moving some of those things along.
Fantastic. All right, so we're gonna continue on with our meeting. So, you can see in your packet that you have the 2024 CoC meeting schedule. Those times are set. Locations are not set just yet. Are we anticipating? Do we think we'll have a lot of them here at Just Gas Power? I think that's our plan, right? That's the
That's
plan.
the plan. I did get some feedback, from Ross Silvers with PSTA about, accessibility due to the bus route here. So I am going to take that into consideration, and review the location for the future meetings, but as of right now, we're tentatively scheduled for here.
Okay,
For those in-person ones.
thank you.
Mhm.
So thank you for having those all set up. We're all good.
Can I just talk about the virtual? So we are, in 2024 going to, I'm hiding from everybody over there. Hi, y'all. Okay. So in 2024 for the CoC, the HLA has planned quarterly in-person meetings as well as monthly information sessions when we are not meeting in person. So we're not going to do the monthly information sessions on the months we meet in person. The information sessions are going to be focused largely on different resources and things like that within the community. So our first information session is going to be booked for February, as you can see, and we're going to talk about healthcare and healthcare programs so that members, supporters, and just members of the community can jump online and learn more about the Healthcare for the Homeless program and some other healthcare opportunities available within our community. On that note, if you have an idea for one of those information sessions, I think we're going to look at transportation for one of them, and a couple of other things, please reach out to me and let me know. I would love to work with you. Maybe we do one on senior services.
Yeah, great.
Point of clarification, these meetings that you're referring to are the general membership meetings.
Yes, ma'am.
These are not the board.
Yes, ma'am. Thank you for clarifying that. That's important.
I assume you will provide us information on the board meeting dates.
Yes, absolutely.
All right, point in time count. Went through my training the other day. I think it was Wednesday. I hope that you all have signed up to work a shift on the point in time count on January 25th. I don't want to shame anybody, but you can be out there. Hope you are. Yeah.
I'm gonna bring this up because I think I bring it up every year when one time count. I hope that we have several. I hope we have several board members that will be participating in the point of time count. I think where there's been times when it's been a bit lacking on board members, so I hope that our leadership is also participating.
Not too late to sign up for the training, right? Victoria, what's the deadline?
It
for the
is
training?
not. The last day to sign up to volunteer is the 15th and training will end on the 16th. If you are volunteering as a team leader, which I imagine many in this room would be, you don't even have to come to a training session. You just watch a video and answer like a 10-question quiz online. You can do that on your own time. You don't even have to do it all structured.
The training is quick. It's an hour online training. More feet on the ground spread out throughout the county means a more accurate count, and that can translate into dollars for our communities. We need that. I would just. Anybody have any other comments about point in time count?
I just have a question on it. So as of right now, I have a trial in my day job scheduled that day, but trials come and go. So is that something that I won't know until the 21st, whether it's going, so that's beyond the time for sign up? Is this something like you can sign up and then?
If you sign up and you do the training, we have people who don't show up
Okay.
every year.
Okay.
So it would be totally okay. If you sign up, I might just make a note in your accommodation that you're a tentative so that I don't schedule you in a really
Okay.
vital. really vital
Right.
place.
Yes, because I'd like to do it, but I don't
Jump
want to
in,
sign up
yeah.
and then not show
Thank
and
you.
have that. Okay.
Thank you.
But get the training, on your phones. Fantastic. All right.
I think we are good. Anyone have questions, comments, any public comment? Yes.
As you guys know, the state of Florida legislative session has started, and they're just beginning to review certainly hundreds of bills. But there's one that is concerned, and I think it's pertinent for the mission of this organization. And if you recall last year, a lot of the protections that tenants receive under local ordinances and advocacy was really stricken down. And this year, there's an attempt to do something more so. However, there are groups that are advocating for, for instance, rent increase does not exceed 30%. I just think we have to be very mindful of those efforts and the likelihood of their success. We don't want any further scrutiny by our local authority and our compassion for those that are struggling. So I'm hoping that this board will be more active, or not be aware of it, that we take a look at these legislative, not only the updates, let's just be actively involved in our various organizations and lend our voice to what is best for those that are struggling out there, who, despite affordable housing, is unattainable for so many of them. So please, let's be there. Let's lend our voices to that kind of advocacy.
Does the CoC have a lobbyist?
We do not.
Well, that's not completely true. We are members of, correct me, Victoria, we are members of a statewide trade association. And via that trade association, they have lobbyists right on our behalf.
Right, because that is an opportunity to engage, strengthen numbers in terms of advocacy and sign on letters.
We do all of that through our trade association.
Right.
We also have per charter, a advocacy committee that, needs to continue to strengthen around many of these issues. So again, I would encourage all members of our membership of the CoC to get involved in that committee, which is the advocacy committee. But we do have a group lobbyist, and I think we've been represented pretty well from Pinellas County, and we've made some contributions to some of the successes that have been achieved over the years.
Thank you.
Thank you for that, Fred. Go ahead.
Just one thing real quick. We elected a bunch of more representatives on this board today, and we recommended a bunch more people join Miners Council. If you are of that group that hasn't stopped by a shelter, or stopped by a soup kitchen, or stopped by one of the agencies providing these services directly, set up a tour, arrange, see what we're doing, see what's going on. It's vital that you have that understanding that you come and be a part of this representation.
I agree. Thank you. April.
My comment is, I just want to, I don't know if everybody had the opportunity to see the Bay News 9 segment on the work that Foley, HEP and St. Vincent de Paul, and I believe the Veterans Association, but, three of our service providers, the work that they're doing. They interviewed some individuals who have benefited, Blossom, right? But anyway, it's on Bay News 9. If you haven't seen it, I would do a Google search. It was a really well done piece. It was beautifully highlighting our providers in terms of the work. They interviewed individuals who have benefited. But shout out to Foley, St. Vincent de Paul, and HEP, who are in Blossom, who are making success. And they talked a lot about the reduction in the numbers. And stably housed and BASH and, all the stuff related to that. But anyway, if you haven't seen it, I would encourage you to Google it or whatever and see it.
Yeah, I did see it, and I thought it was phenomenal. The only other thing I was gonna mention is that it's some of the national news is a bit disturbing, that there's been a 12% increase in homelessness across our country. And particularly with all the efforts that many of us have put in to try and reduce that number. It's just a sad commentary for our country that the numbers are going up. It's the highest that it's ever been. And so, I know we will all continue to do our utmost best to try and reduce those numbers here. But it really is a sad commentary, particularly when a lot of us work very hard to try and make a difference.
It is the most important work. It really is, giving people stable shelter so that they can live their life and be productive and be safe and healthy. And
And, we have to work hard. It's not a fun topic to talk about, and it's not popular topic to allocate funds to. People don't like to do that, but we need to be persistent, positive pressure and work together and look for creative solutions, especially with our faith-based. I think that's untapped in our county. That's just my opinion, that we can really start to engage that. I think there's a lot of potential there. That's my hope, but you all are phenomenal. The resumes that we went through are amazing. Thank you for being here. Thank you for your work. I couldn't be more proud of looking out at you all and working with you, as we start 2024. So with that, the meeting is adjourned. We're gonna roll into a board of directors. Do you want to?
Yes, absolutely. Everybody go ahead and take, do you want to take 5 or 10? You decide.
We can do 10.
10, okay.
Are we gonna have people trickling in on Mars because of that point?
All right, everybody, that is the end of our meeting here. Thank you all so much for joining us. If you are attending the board meeting, please sign into the board Zoom.